I'm joined today by Clare Heggie, PhD candidate at the University of New Brunswick in Canada, to talk about her review article titled Health Outcomes and Healthcare Access Experiences of Incarcerated and Recently Released Women in Rural Areas, a scoping review. Welcome, Clare, and congratulations on your article.
Thank you.
I wonder if you could start off by introducing us to the research team.
Yeah, so as you said, I'm a PhD candidate at the University of New Brunswick, which is on the east coast of Canada. And my research team for this paper included my supervisor, Dr. Martha Painter, who's a professor in the Faculty of Nursing at UNB. Alex Goudreau is a clinical librarian at University of New Brunswick as well. And Chloe Fuller is a recent graduate in Masters of Forensic Psychology at St. Mary's, which is also on the east coast of Canada. And so we worked collaboratively on this literature review.
Terrific. And what was the need for this research? How did it come about?
Yeah, so we know that women and gender diverse people experience many barriers to accessing healthcare, both while incarcerated and sort of in that post-transition, up to a year period when you've left a prisoner jail and you've returned to your community. So we know that people have experienced poor health outcomes and then also experience barriers to accessing care. And so we can kind of assume that those barriers might be exacerbated in a rural or remote area, as we know people in rural areas face many barriers accessing healthcare regardless, but there is kind of a lack of evidence on the experience of being either incarcerated in a rural area or returning to a rural community. And we're specifically interested, our research team, in the experience of women and gender diverse people who are experiencing incarceration. And so we kind of have that lens as well. So just kind of trying to figure out, if you are a woman and you are incarcerated and you're experiencing all these barriers to accessing healthcare, if you add the rural piece, how will that change things?
Yeah, it's really fascinating, Claire. Really interesting research. So what were your key findings?
So we found 48 studies. The majority were in the United States. We didn't identify any studies in Canada, which is where our research team is located. Some studies in England and Australia as well. So that was an interesting finding for us. Just shows that there is a lack of research in Canada where we work. But then kind of broadly across all the studies, we found really a focus on substance use related outcomes. The majority of the studies were, evaluating perhaps a MOUD program or another treatment program. And so the research is definitely focused on that health area. So that was kind of another gap we identified in terms of, how are people accessing healthcare in rural areas? We found, unsurprisingly, transportation is a huge issue. And so if you're in a prison and you're accessing healthcare, it's going to be dependent on the availability of transport resources, so both the vehicle itself and staff. And so unsurprisingly, many studies showed that this is even more of a barrier in a rural area. And then in that sort of rural community, after leaving a prisoner jail, similarly, issues with transportation, childcare, housing, all those sort of material needs not being met. Again, something you would experience in an urban area, leaving prison as well, but really heightened in a rural community.
Yeah, so what are the implications of this research? What needs to happen next?
Yeah, so it's kind of being a literature review, it's kind of just a first step to see what's out there. So I think, again, as a Canadian team, we've identified a lack of research in Canada, so that's one sort of future direction. And we've also identified, there is this focus in the literature on substance use, and this is not surprising if other evidence synthesis of health in people in prisons have found the same thing. And so we're also interested in exploring, how do people access routine primary health care? Of course, substance use treatment is a part of routine primary health care, but there does seem to be a gap in the literature on going to a nurse practitioner. Just how do you access routine health care? What happens if you have to get transport to an emergency department? There is sort of a lack of attention to those routine needs. And so that's something that our team is interested in exploring as well.
And why women and gender diverse people?
Yeah, so, women and gender diverse people face, you have unique health needs. And of course, in the carceral context as well. And they are actually a very rapidly growing prison population. Depending on what statistics you look at, very fastest growing in many jurisdictions, including Canada, including Australia, and in a lot of global contexts as well. So they're this very rapidly growing population. However, proportionally, still many more men are incarcerated than women. And so we have this growing population, and we kind of have this correctional health system that may be not prepared to meet gendered healthcare needs. In Canada, for example, many provincial prisons where people are incarcerated are co-located. So it's both men and women. And you can kind of imagine how the correctional healthcare system may not have been designed with women in mind. And so we're particularly interested in what healthcare needs may not be being met for women and gender diverse people, and maybe not being considered in the design of correctional healthcare services.
It's just so fascinating, and I'm really looking forward to what comes up from the rest of your PhD research. Thank you so much for talking with me today.
Great, thank you so much.